this is Kogan from the KNM channel. So today I'll be making a short report on the COVID-19, which has been an issue since late December 2019. So this virus was first identified in central China back in December, and the illness has spread across the world. And this is leading to an outbreak that the World Health Organization has decided to call the pandemic as of today, March 11, 2020. And we will be going through some stats as well as maps to understand the current status for the virus. Originally, it was believed that the virus was only passed through direct person to person contact with someone from an infected area. But over time, um, there are fears growing that the virus could also be transmitted through non personal contacts, like any other colds and flu that we usually caught during the cold winters. So the authorities as well as city mayors around the world are recommending the public services to keep the areas clean. For example, here in Montreal, Quebec, with the public transporting service, they have suggested to keep the trams, the metro clean on a regular basis, and the STM, which owns the public transport in the city of Montreal, they've asserted that they would clean their trains not on a daily basis but multiple times to a week. And they've also assured that they would clean it with some detergent, wipe down the forks and handles and seats wi- with an alcohol based detergent. And this is also valid for other countries like in Britain, where they would also use alcohol sanitizers after visiting public places. As far as Quebec is concerned, we have nine infected people here in Quebec, in the province of Quebec. Two of them are admitted at the hospital, so they're being treated there, and seven are being quarantined on their own, so they are reducing any form of contact with the rest of the population. In other words, they are also helping others by not making any contact with them, so the virus would not spread as fast as it did earlier this season. Nine people is only for the province of Quebec, but as of now, there are 108 infected people nationwide in Canada, and most of them are in the province of British Columbia and in Ontario, where most people travel, and that's also the provinces where um, most foreigners and airlines land or have transits. Looking at the USA, we have 938 cases reported since 21st of January this year, and we have also 29 deaths so far. Another stat also includes those who were repatriated to the United States, and there are three persons from the Wuhan city in China, and 46 others from the Diamond Princess cruise ship. They were all tested positive, and they are currently admitted at quarantined facilities in the US for treatment. The testing for the coronavirus was slow to roll out in the US, but as more and more Americans get tested, it's becoming clear that the illness is already spreading in the US. So that is a very high alert, and it's now been confirmed in some 3 dozen states, with the largest clusters in Washington State, California, and New York. President Donald Trump has announced a travel ban to the United States from the Europe. This is going to be in place for the next 30 days in an attempt to reduce the spread of the deadly virus, which is, if we look at statistics worldwide, so we have surpassed the 100,000 infection rate, which was pretty much the limit bar on a logarithmic scale, but it has gone beyond this. So we don't know actually when we would reach a threshold, but right now we have 126,145 infected and reported cases, of which 4,627 are dead and 68,240 have claimed being recovered. So yeah, that's pretty interesting, since more and more people are recovering from this deadly virus. Recently, Italy has announced that they would close all businesses except groceries and pharmacies, which are indeed necessary for survival. The country has decided to quarantine itself until new announcements are made. That is because Italy is becoming in the new epicenter for the outbreak, after Iran, which is also another country which is severely affected by this virus, and the number of infections are growing on a daily basis. Okay, now if we get back to Canada and the different plans that the government has to offer, so Canadian businesses and communities can better attack and protect themselves and their neighbors from being infected by this virus. As of now, there are 107 infections in Canada, and most of it being in the province of British Columbia and Ontario. And as of today, the Canadian Prime Minister has announced $1 billion package to help the Canadians cope the COVID-19 outbreak, with half of the money going to the provinces and territories. The announcement came just hours after the World Health Organization announced that the virus is now considered as a pandemic. We have some other response package which include a 500 million for the provinces and territories to fund healthcare systems and support mitigation efforts, and another 50 million to the Canada's public health agency um, to help educate the public and also to improve their communication efforts, so people can better cope the virus and better help others as well as protect themselves. Another 100 million is to support the federal public health measures, including surveillance and increased testing at the National Microbiology Lab, and another 50 million to help vulnerable countries to prepare and respond to the virus, while also supporting efforts by the World Health Organization and other partners. In general, the Public Health Agencies of Canada says that the risk remains low for the Canadian population, but it could change rapidly. So, and on this, they are putting an emphasis on an increased risk for senior citizens, meaning people 65 years of age and older, because they have a compromised immune system. So It's not as strong as compared to younger people who have a better immune system.